Once the sleep apnea testing has been completed, we look very carefully at the data that we get from the sleep apnea test. Generally speaking, we will categorize sleep apnea as either mild, moderate, or severe, and this is determined principally by the number of episodes of apnea per hour of sleep during the testing. Mild sleep apnea is considered anywhere from 5 to 14 episodes of apnea per hour. Moderate is between 15 and 29, and severe sleep apnea is 30 or more episodes per hour of sleep. However, just as important as counting the number of episodes per hour, it's very important to look at oxygenation. Because after all, the body doesn't really count episodes of apnea. It's really not a physiological parameter. What the body senses is oxygenation. And we look very carefully at what is happening during the night, and particularly with apneic episodes, to the amount of oxygen that's being carried in the blood. And when oxygen falls significantly, this places a tremendous stress on the body and actually is what is responsible for many of the related conditions or complications of sleep apnea. Related to oxygen, we look at how low does the oxygen level go at its very worst. We call that the O2 nadir, or lowest oxygen during the testing. But we also look at, for each period of apnea, how long is that reduced oxygen level present, and how deep are on average those desaturations, which is what we call them. And putting all of that together, the duration and magnitude of oxygen reductions with the frequency of those reductions, we get a much clearer picture of how much risk this sleep apnea poses to the patient if they go untreated.